Hey,
Hey, we're live.
Yeah, we are live, and apologize for the delay.
Yeah.
Trying to do Facebook Live on split screen, and I'm Steve Edelman. Got my good friend Jeremy Pettus. We're both endocrinologists slash internal medicine doctors. We both have diabetes. We work at TCOYD and the University Hospital. I just want to let all of you know that essential item to have, other than hand soap and Purell, is a yardstick or a tape measure. We are 6 feet apart, and that's important. Social distancing is what's going to save us in this mess. We're here to answer any of your questions. Many of you have sent them in ahead of time, and we're going to start because we want to answer as many questions as we can. Thank you for joining, and apologize for the delay for sure.
Yeah. So, this isn't a Facebook Live event to talk about COVID as it pertains to patients with diabetes. But Steve, maybe we can start off with just some kind of basic facts about COVID, if you want to talk about that. People are worried about maybe how it's transmitted, just kind of common sense measures they should take. Everybody should know about them.
Okay. Yeah, I think, there are first of all, there are certain areas of the country that aren't hit as bad as New York. We're in San Diego, and so far things are totally under control. However, I want to just mention a few things that I've really picked up reading a lot and watching the news and doctors, and I think you've all heard this. I just want to emphasize it. That washing your hands, of course, a lot. But the other thing that I think was emphasized a lot more lately is you've got to really keep your hands away from your eyes, your nose, and your mouth. Now, theoretically, we touch our face 20 times an hour, and anything you could do, you know those things they put on dogs around the head so that they can't touch their face? I mean, they should make them for humans that are clear, because that's what spreads the virus. And so that's really important. Jeremy?
Yeah, I think, the main way that this is spread is it is a respiratory virus. So people will cough, they'll sneeze. You can inhale those droplets, but they can cough, sneeze on their hands. That's why we make a big deal about washing your hands and not shaking hands, because that's a way that, it gets transmitted.
Yeah, and there's no question that if you're sick, you got to wear a mask. Healthcare workers wear a mask. This has a little shield too, because any droplets can go into your mucous membranes of your eye. If you have glasses and contacts, wear the glasses, because it's one layer of protection. And now there's kind of a controversy that everyone should wear a mask, not the N90 expensive ones, because you might be a carrier and not know it. And so it would prevent you from spreading. So we'll have to hear from Dr. Fauci about that.
And some people, say, how far should I take this? What if I get a package delivered from Amazon? Do I need to wipe it down? Or what if I pick up a thing of Cheerios at the grocery store? How careful do I need to be about just touching things?
Yeah, I think you should be careful. I did go to the grocery store, and I put on 2 gloves. I used the right hand to push the cart, the left hand to grab the objects. Now, did I go home and wipe everything off afterwards that I bought? No. But, do what you can. Yeah. I don't know. What do you suggest?
Yeah, and so Fauci says that, the virus can survive on surfaces, mostly metal and glass, for at least a couple hours, if not longer. But, if you're getting a package coming from Amazon, you probably don't really need to be worrying about that. But, it's always good to err on the side of being cautious. Now, one of the other things to keep in mind is that, this virus it can be transmitted when people don't have symptoms, which is one thing that's been so problematic about this going on and on, is that people that aren't even feeling ill can be, spreading it. So just keeping that in mind.
Do we want to just say a few words before we get to some specific questions? I'm sure there's some in there. Are people with diabetes more at risk for getting the virus? And once you get it, are you more at risk for having a bad outcome, needing to go to the ICU? Now, I did a video on this a couple weeks ago, and let me just take people with type 1 diabetes with really good control over the long term. Your A1C's less than 7.5, and you don't have any other underlying heart disease. You don't have heart disease, kidney disease, liver disease, asthma. If you're totally healthy, there is information that you are not at risk for getting an infection, any type of infection, more than someone else your same age who does not have type 1 diabetes. Now, is there specific data on COVID? No, but we know that high blood sugars, typically over 200 for a long time, dampens the effectiveness of the immune system. And that's probably a good lay way to describe it. So you're prone to get foot infections, pimples, any type of infection. If you have type 2 diabetes, if you have the associated conditions of heart disease and some other medical problems, then you're definitely more at risk. And also, the older you get, just no matter what disease you have, makes you a little bit more susceptible.
I think it's important to separate risk of getting the virus versus complications from the virus. And in general, when we talk about people with diabetes, there's no data showing that people with diabetes are more susceptible to getting the virus. So it doesn't seem like people that are at least well controlled are not more prone, that you should be worried that you're more apt to getting the virus. But people with diabetes do sometimes suffer the complications from the virus more commonly. And as your blood sugar gets worse or your A1C goes up, those outcomes can be even worse. So basically, people with diabetes are a little bit of a higher risk of going to the hospital, of having to be intubated, unfortunately, of higher mortality. So it's extremely important always to take care of your blood sugars, but especially right now, if you do get infected with COVID, making sure your blood sugars are under well control.
Yeah, and test a lot. Some of you folks that do not have a continuous glucose monitor, and probably most of you do not, you got to really get out your glucose meter, and this is a time to test a lot, because for some of you, you might be eating way worse than you normally do. Others might be exercising more and really sticking to an exercise dietary plan. So it's like I always say, it's like adult diapers. It depends. And so you have to really know where your numbers are.
So there's a couple questions about that. People kind of want to know, okay, let's say I do get COVID. What do I need to be doing in terms of my diabetes that I might otherwise not be doing?
Yeah, I mean, it's basically common sense. Test a lot. If you're sick, some individuals with medical illnesses, their blood sugars go up. So depending on the medication you're on, if let's say you're on insulin and you know how to adjust it yourself, with or without the help of your caregiver, go for it. You want to keep your blood sugars below 200 and avoid hypoglycemia below, let's say, once you start getting a lot of numbers below 80, you should think about backing off. And so I don't want to get into too many specifics because there's basal insulin, there's fast acting. If you're a type 2 on oral medications or the injectable drugs like Trulicity or Victoza, things like that, Ozempic, you don't really adjust those. And if your blood sugars are consistently higher than normal, then get on the computer, get on the phone, give your caregiver a call, because they can make adjustments over the phone.
Yeah, so I think that's all really important. The other thing is, like you said, just test more, because the bottom line is anytime you have an infection, your blood sugars are more difficult to control. Classically, they tend to be elevated. You get this kind of stress response. Your body is, kind of activated against the infection. Blood sugars can go higher. So you won't know that unless you're testing, having a continuous glucose monitor, frequent testing. And if your blood sugars are consistently high, what do you do about ketones, especially for the type 1s? Any information for them?
Yeah, go ahead.
Yeah, so I think if you notice that your blood sugars are persistently high, over 300 or so, especially if you have any nausea, you're vomiting, you have muscle aches with it, that's when you might actually be going into mild ketosis or DKA. So it's important, if you have a ketone meter, and this might be a good time for especially all you type 1s to get a ketone meter, check your ketones. If that level gets to be over 1 or so, that's when you're getting into a little bit of a problem area with your ketones. And the treatment is really hydrate, drink a bunch of water or non-calorie Gatorade, those types of things, 0 sugar. You need fluids, and you need insulin. So taking insulin every 2 hours or so to bring those blood sugars down, and then you can check your ketones every hour to see if they're coming back down into the normal range. At any point, if you have ketones and you are vomiting, that's when you would need to go to the emergency room, because people get into real trouble with DKA when they can't hydrate. Hydrating is actually probably the most effective thing in terms of getting out those ketones, along with insulin. And if you're not able to keep anything down, that's when you can get into trouble and you need to go to the ER.
You want to mention carbohydrates at all?
And carbohydrates, so you need to take insulin. And if your blood sugar, let's say your blood sugar is already 180 or 160 or so, you still need to be taking insulin, so you might need to take carbohydrates with the insulin just to allow you to keep taking insulin, if that makes sense.
Yeah, and the carbohydrates actually, believe it or not, they help turn your brain off for ketone production. The other big mistake that we see all the time is that, let's say you're so sick you're not hungry. So you say, hey, I don't need my insulin. I don't need to take my other oral medications. That's a huge mistake because, as Jeremy said, a lot of times the need for higher doses of insulin and other medications, even though you're not eating. So that's key.
All right. So there's some other questions, some themes here. Basically, should I be worried about availability of diabetes supplies during this time?
If you're running out, yes. Don't forget that most pharmacies will deliver if you're afraid to leave your house. And most insurance companies, from what I'm hearing, including Medicare, are reducing some of the restrictions, like they have to get a copy of your doctor's notes. And I think the best thing to do is stay in touch with your caregiver. Let them know if you need a prescription refill. Email the TCOYD website, and if we can help in any way, we will. So yeah, you should worry if you have vital medications that you're running out of.
So, but I think from a big picture, the major manufacturers of insulin have been saying that there's no, changes to the supply line. So I don't think people need to be worried that, globally or nationally that we're going to be running out of insulin. So it's not like toilet paper where you need to go and just, for some reason people are gathering that up, that you need to go and kind of hoard insulin. Yeah. I think it's always a good idea to have, a supply of insulin, potentially even more than you might need. But it's not like people need to worry that they need to go out and get extra right now, because if they don't, it's going to be gone and somebody else is going to get it.
Yeah, that's a good point. I missed the point of the question, but Jeremy and I get these emails from all the pharmaceutical companies, device companies, including Dexcom and others. They have plenty of sensors, plenty of medications, plenty of insulin. So I wouldn't worry about that at all. It's probably the way you get your own medication if you pay cash and insurance.
So you need to be a little bit more vigilant. Everybody's guilty of like, oh gosh, you use your last drop of insulin and then you just run to CVS or whatever, get it refilled. You got to be way more proactive than that. At least a week or two in advance, making sure you have a prescription, that it's there waiting for you. As Steve said, a lot of these pharmacies now are waiving the delivery charge, so they can actually deliver these medications, drop them off at your doorstep. That's helpful. There's been a lot of push to Congress to help, again, kind of on a big picture, to eliminate co-pays, because there's really two sides to that question. One, can I get insulin? And then two is, can I afford it?
Yeah.
Do you want to comment on that? When people are worried about losing jobs and things like that.
Gosh, yeah, it's a tough situation for sure. There is a thing called compassionate. There's what's the word where you go online and if you don't have any money, you can get some insulin. Patient assistance programs, and there's a lot of good organizations out there. Let me turn off my text. Including our website, we put together a resource page, and the DRCC and other organizations, they have resources, and so you just got to do your homework.
Yeah, it's definitely stressful for people,
yeah.
For sure. So what about this? Do I keep taking my medication even though it suppresses my immune system? So this person probably has another autoimmune disease or something that they're taking some kind of immunosuppressive therapy.
Well, I can start and then you can add. If it's, let's just say you had a kidney transplant, and you don't want your kidney transplant to start rejecting because you've dropped the immune response. So I would say in those cases you should take it, but be extra vigilant about being quarantined so that you really don't have any exposure. Try not to go near any family member who has been out in the real world talking to people. I know it's pretty strict. So if you need this medication for your health, by all means continue it. And if you're not quite sure, it's a good question for your caregiver.
Yeah, I would say that's the short answer, is always check with your doctor, but you don't want to stop anything without checking in with anybody. Because if it was for a kidney transplant, for example, you stop taking that, you could reject the kidney, and you might not ever get COVID. So you just have to be thinking about this. My wife works in she's a gastroenterologist and does a lot of inflammatory bowel disease. people with ulcerative colitis and Crohn's disease that are taking immunosuppressive medications. She gets this asked all the time. And usually the answer is don't change anything. These drugs are generally doing more good than harm, but check with your provider for sure. People have questions too about these other medications that have been on, in mainstream media, particularly hydroxychloroquine, zithromycin. Should people be taking these medications if they get a fever, if they should be asking their providers for it? What do you think?
You go first this time. I do have some thoughts on it, but I don't want to go first.
So there's several medications that have been looked at that might have some activity against this COVID-19. And this goes actually back to the time when SARS was an outbreak, and they were looking at medications that might help with that, which is another coronavirus. And they found that chloroquine, which is an old malaria drug, actually had some activity in kind of a petri dish situation against the virus. Chloroquine's a really old medication that has a lot of side effects. So there's a newer form of it called hydroxychloroquine. The trade name is Plaquenil. That has it's the same medicine essentially. It does the same stuff, but it's less toxic. So people use Plaquenil a lot for other autoimmune diseases, like lupus is a common one, rheumatoid arthritis. And this drug now has been shown that maybe it has some effect in terms of reducing viral load. If you ask the infectious disease experts, they'll tell you it's way too early. These studies have not validated this. It's all kind of not anecdotal, but close. That we don't really know the answer. And there's a study showing that if you combine Plaquenil with azithromycin, which is an antibiotic that's in a Z-Pack, that might also be efficacious. So in terms of should you go out and get these medications, the answer is really no. I've heard from rheumatologists now that their patients that actually need these medications are having a hard time getting on them. People that are, that have lupus, that use Plaquenil for it. So we don't want to short supply them. And really, we just don't have the data right now to know who should use these medications. So I wouldn't recommend asking people for it. Actually, if you try to get a prescription for it right now at your pharmacy, they'll probably say no or really limit the number of pills you can get. So it's early days. I'm very hopeful that these drugs might pan out because they're widely available and generally very cheap. It's a little too early to say you got to go get these medicines.
Yeah, I think well said. I'll just add a couple things. As you saw the news yesterday, the FDA gave approval to use it by physicians in the ICU setting, like your kind of last-ditch efforts and someone's doing poorly going down the tubes. They've used it. Try not to get too much into these anecdotal patients that tell you that they took one pill and the next day they felt awesome. And I also know that hydroxychloroquine and chloroquine can cause cardiac dysrhythmias. And I've heard cardiologists say you got to be super careful. So I agree with Jeremy. This is not the time yet, and there's studies going on right now. And it's not going to be a cure, but it may dampen the severity of the condition if you get it.
Mm-hmm. All right, Steve, what should I do if I have to go to the hospital? So I'm assuming they mean, let's say they feel sick, they have the symptoms of COVID, fever, chills, body aches, shortness of breath. Anything particular for somebody with diabetes that they should know about?
Well, some ERs are set up better than others. If your healthcare system has a hotline, you might want to try to get a hold of your healthcare provider because they have. I just walked out of the VA hospital and there was a whole entrance on the left for people who thought they had COVID. And there was a testing site. They measured your temperature as you went in. They kept people separated. For sure, make sure you put on a mask before you go anywhere. And it's just good to know, what is the procedure at your particular hospital. Sometimes they want to call first. You may not charge into the waiting room when you think you might have it because you might expose others. So typically, it's try to get a number first as you're going in if you're really sick. Obviously, if you feel like you don't need the ER, you're not going to go. But do you have anything else to add to that?
No, I think that kind of sums it up. I'm scanning through these questions. There's some good ones. So it says, what medications should we have? This is kind of several parts. What medication should we have on hand in case of a light case? And this person says Tylenol or something. So maybe it's an opportunity also to talk about this issue with NSAIDs that came up. Was also in the news.
Sure.
So do you want to go for that?
Well, I'll just start off by saying one thing, that NSAIDs, non-steroidal anti-inflammatories like Motrin and Aleve, they can be really harmful to your kidneys. Now, if you have perfectly normal kidneys and you stay below the maximum prescribing dose, I don't think you'll have a problem using it temporarily. But I have some kidney dysfunction, and I want to maintain whatever I got. So I am sticking primarily to Tylenol, which has no effect on the kidneys. Now, if you take over 4 grams a day for multiple days in a row, it can cause liver damage, but 4 grams is a lot. The typical Tylenol pill is like 250, I believe. Yeah. So you could take 2 or 3, 4 times a day. You're not getting close to the toxic dose.
Yeah, I think, at the end of the day, this is a virus. So when it comes to treatment at home, if you have, kind of a mild case, it's the typical fluids, rest. There really is no specific therapy for it other than treating the symptoms you might have. Tylenol is a great option for, body aches and things like that. So just typical kind of symptomatic treatment.
Yeah, throat lozenges, cough syrup. If it raises your blood sugar, you could probably deal with that. Just remember, if you're on one of the older Dexcom units, 5 or 4, it is affected by Tylenol. It's going to give you abnormal numbers. If you're on the G6, you're golden.
Mm-hmm. And then it also says, should we avoid any medications? And then specifically it calls out Afrezza. Do you want to talk about that? Right? I can start this one. So Afrezza is an inhaled insulin. That's obviously, I think the question is that this is a respiratory virus. Is there an issue because I'm inhaling this insulin into my lungs? And I would say, just for everybody out there using Afrezza, keep using it, because if you're using it, you might be getting good results from it. It's keeping your blood sugars under control, and that's so important. If you get to the point where you think that you have this virus, you're having some shortness of breath, then I would stop it. We don't have any data that Afrezza makes things worse, but if you're already having lung symptoms, I would probably stop it.
Totally agree.
Yeah. Okay. I don't know if you mentioned this, but this was kind of in the vein of the NSAIDs, comment about ACE inhibitors and ARBs. So
you explained what those are.
Yeah, so non-steroidals, Steve already mentioned what those are. ACE inhibitors and ARBs are types of blood pressure medications that are very commonly used in everybody with high blood pressure, but especially people with diabetes. These are medicines like lisinopril or losartan. They're very, very effective in terms of reducing blood pressure. And the same kind of issue that cropped up with the NSAIDs in terms of is there something about NSAIDs that when you take them, it makes the virus more potent or something like that? That kind of extended to these ACE inhibitors and ARB anti-hypertensive medications. And again, it's just all very early days. These medications, ACEs and ARBs, do so much good in terms of keeping your blood pressure under control, helping your kidneys, your heart, and things like that. So please do not stop these medications.
Yeah, I would just say that with the hydroxychloroquine, there's way more data on that than there is to suggest that these important blood pressure medications do something to excite the virus. I think there's no evidence at all that comes close to getting to the point where we would stop it for safety. So, yeah, maintain your good blood pressure control. And these 2 medications are specifically good for people with diabetes because it's been shown that they protect the kidneys as well.
Yeah, so this is a good question. They're all good questions. No bad questions. So it says, I'm needing more insulin than usual during quarantine. Is that usual or unusual? And I think this is a good time to talk about how to keep healthy at home. Maybe people are having a hard time doing the normal exercise. Their diet might be really different. So maybe we can kind of take those on one by one. So first of all, are you using more insulin than usual during quarantine? Is that usual? I think that's probably as a result of changes in lifestyle. That people might be home on the couch a lot more, not doing their normal daily walks. They might be not sleeping as well. They might be more stressed. They might be eating differently, getting takeout more or less something. There's so many different things that are changing because of, the situation that we're all in, that I don't think there's something special about the quarantine or there's something in the air that would make you use more insulin. But it's definitely kind of these lifestyle things. So how do we stay healthy during quarantine?
Well, gosh, I mean, I've had certain patients who are doing way better. They're just using this time to stay on top of their diabetes. I know a lot of people who are going out for walks like they never did before. And I do think walking outside with fresh air is important. Obviously, staying away from other folks walking around. And I've had other patients say that they're eating a lot of takeout and they just don't have the energy or the motivation to get out and exercise. You may not be in a situation where you can just jump out the door. I had a patient who lives in an apartment with 19 other positive patients in it, and not in San Diego, in Seattle, and she feels like she can't even leave her apartment because she might be exposed on the way out to go for a walk. So, you know, you got to do whatever you can. My mother is quarantined to her room at her nursing home, and I had her set up a little track around her room.
Yeah.
Just something to get up and move, calisthenics, go online.
Yeah.
Great stretching and exercise in place. I don't know, what do you suggest?
I just think, you know, you have to be really mindful that about your kind of activity now. Because, you know, usually when I go to work, I'm actually doing a ton of steps. I have my watch that I don't even realize that I'm moving so much. And now that I'm not really at work, you know, it is much easier to kind of just be sedentary. So you really have to try to schedule as much as you can, a half an hour, something to go walk around the, you know, wherever you can, walk around the neighborhood. If you have some kind of, you know, equipment at home, that's great. Peloton bike sales apparently gone through the roof. Because, you know,
should have bought stock.
Yeah. But there's a ton of things online now, kind of quarantine videos that you can use, just like, you know, push-ups and sit-ups and things that don't require, you know, a gym. This is becoming, you know, a big thing now. In terms of diet, you know, you always have to kind of check in with your provider, but it's a chance to maybe really be mindful of your carbs. Personally, I've started doing some, you know, intermittent fasting, trying not to eat after 8 p.m. and then all the way till noon the next day. Just something to kind of keep things in check. And I'm not, you know, recommending that for everybody, but it's a time to really stop and think about, how am I eating, you know, now versus how I was a month ago? What's my activity now versus what it was a month ago? And that's all going to come back to your blood sugars, and, you know, you're going to see that if all of a sudden you're just sitting on the couch all day and eating pizza, well, guess what? You're going to need more insulin.
Yeah, just try to make it a positive. We're in this situation for another month at least, and we should just try to make a positive out of a negative. And I never heard you use the word mindful. Wow. Yeah. He's getting quite touchy-feely these days.
I took a class at UCSD, but I actually dropped out because I couldn't keep going.
Yeah,
this is the time. But I will say, you know, I believe in this positive thing. There's a silver lining here for sure. I've never seen so many people out walking.
Yeah.
And it's a good time, you know, to get exercise and then just chat with somebody, you know, like, anyways. So can you talk about herd immunity, and can that help? Herd immunity. You know, so if a certain number of people in the population get infected with it, will that help the rest of us, you know, stay safe?
I'm not sure on that.
Yeah. I think ultimately for that to occur, we would need a whole lot of people to get infected to, you know, stop the spread of the virus.
I resent you calling Americans herds. I think I put that with cattle. I can tell you that I'm pretty sure this is true. If you have it, and most likely you're going to get better, you cannot get the COVID twice. And they are doing studies where they're taking the antibodies against the COVID in someone that recovered, and plasmapheresis, taking it out and giving it to sick ICU patients. And so we'll see the results of that, and be hopeful that works. And if you have recovered, get ready to donate blood.
So kind of along those lines, I've had type 1 say, you know, I have an autoimmune disease. Type 1 diabetes is autoimmune. Does that mean that I'm in this immune dysfunction category? What's the difference there? Do I need, you know? So the bottom line is, if you have type 1 diabetes, you're not immunocompromised. It's an autoimmune disease that's very specific to the beta cells of your pancreas that make insulin. So you're not, again, at higher risk of getting the infection. And I think that's worth repeating, that people with diabetes, as far as we know, are not at higher risk of getting the infection. It's just that once people do get it and they have diabetes, the complications can be more common.
Yeah, and just remember, there are a lot of conditions that are autoimmune. Like, there are certain types of thyroid conditions that are autoimmune. It doesn't put them more at risk either. Now, if you have a serious autoimmune disease like lupus or a kidney transplant, and you're on steroids that suppress the immune system, yeah, then you got to be more careful.
So this is something that we just talked about. What can I expect with a telehealth appointment? Are they as effective as an in-person visit?
I would say I'm going to take the positive side. I think they're better. Now, if you're someone with diabetes, you know, to be honest, when's the last time your diabetes doctor examined you, other than to increase the billing level? You know, if you can see the person, I think that is helpful. We have a video on our website. You know, I can summarize it and you can add on, you know, be prepared. Get your information together, get your glucose level together. If you can send in your information, gather any recent blood work that you got at the laboratory that you have access to, and have your questions. And really use that time wisely. I know you got some stuff to add.
Yeah, I would say, you know, go to our website because we did a whole video on this, and it was pretty fun doing. But it's very convenient for the patient. You can do it at home. You know, you don't have to worry about parking or getting there in time, all those kinds of things. You do have to take it on yourself to be more proactive, getting prepared, like Steve said, making sure you got all the information from the visit, you write it down, it gets communicated to you however you want. But clinics have been doing these telehealth visits for diabetes for years because diabetes lends itself very well to these types of visits. So it's something that's already been in place. But now with COVID, a lot of institutions are kind of ramping up and bringing it on board kind of immediately. So I would say if you have a telehealth visit, you know, scheduled with your provider, that's definitely good news that your institution or your where you go to get your diabetes care is taking the initiative to making these appointments available. You should definitely take the opportunity, and you should not feel like you're getting second-rate care.
Yeah, and I would say this too, maybe ahead of time, check on your technology. Do you have the equipment at home to do a video visit? And if that doesn't work, just change it to a phone call. You know, I asked one of the providers that we work with, Laura Barba, and I said to her, do we really need the video? Because at UCSD, they're working out some of the bugs, and and it's not as smooth as some other systems, but it's getting better. And she said, she convinced me that she thinks it's invaluable. You see the home setting, you see the kids running around, you can see, you know, if the person's not feeling well, you're looking at them goes a long way. So get the technology worked out first, especially if you're not tech savvy, like some of us.
All right, so this actually applies to COVID and non-COVID situations, but it says, I'm concerned that the hospital will not know how to treat my diabetes or use my pump. Should I bring supplies and treat my own diabetes? How do I handle this?
The answer is yes. You know, we totally agree with you, whether it's virus situation or not. There are a lot of people, I'd say the majority of people do not know anything about pumps or even continuous glucose monitors. So bring all your stuff and plead with the caregivers to let you use your pump in the hospital. Now, every hospital has their rules and regs. Some hospitals just say we take it off right away, but I think it really depends on what you're in the hospital for. If there's any chance that you might become out of it, or they give you sedatives because you're not feeling well, then you should let them take over and they'll give you the insulin themselves. But yeah, bring all your stuff with you for sure.
I would say advocate. If you can't advocate for yourself that you have diabetes, somebody else, a friend, family member, letting them know. Like Steve said, every hospital has a different policy. Our policy is that we allow patients to continue to use their pumps as long as they meet certain criteria. You know, that they're basically with it, they can still participate in their care. But obviously, if it comes to a situation where you're in an intensive care unit and have to be intubated, then things have to transition over to the healthcare team. But you should not feel bad or that you're doing anything wrong for insisting or trying to at least be a part of your own diabetes care in the hospital. I would say you should actually do that, because if you assume that the healthcare providers are on top of it, they might not be. They might not even know that you have diabetes. So you have to make sure to kind of stay on top of that.
Yeah, in New York City, they're asking the medical students who haven't graduated yet to work in the ICU and hospital setting. And I would say for everybody, on a CGM or not, bring a glucose meter. Because nowadays they're trying to limit the contact between you and the nurse and the doctor. And they're even making kind of an emergency approval to use continuous glucose monitors in the hospital so the nurse doesn't have to prick your finger, get blood on herself. So bring your testing equipment for sure.
All right. Especially during this time, how crucial does stress play a role with your blood sugars?
As someone would say, huge. And I did do a video program with Bill Polonsky, who is truly a touchy-feely guy, a clinical psychologist, and we addressed that in a little 10-minute video that's not posted yet, but it will be soon. And all I can say is everybody is affected differently. And if you're not affected in some way, then something's probably wrong with you. We all have fears and anxieties, and if you're prone to that, then it might be even worse. There's a doctor that Jeremy and I work with. He's just super well grounded, and Schaefer I'm talking about, and he texted us that he had a nightmare. He woke up gasping for air that he had the COVID virus, and he was about to be intubated. So, and he said it was subconscious anxiety. So it does affect us all. It affects us differently. Reach out to good sources. My brother's a clinical psychologist doing all of his visits now over the phone, and that's another good example of telehealth. You don't have to be sitting in the office.
And stress always raises your blood sugar. And it doesn't matter if there's COVID or no COVID. People will say, I get in a car to go to work in the morning, my blood sugar is 100, and by the time I get to work, it's 200. Just being in traffic, that anxiety, that adrenaline raises your blood sugar. You're doing public speaking, whatever. So if you're in kind of a heightened state of anxiety constantly, it can have an effect on your blood sugars. Just be aware that if you are taking insulin to kind of bring those down, they tend to be more sensitive to insulin corrections because it's not like you ate just a big, hot fudge sundae, as Steve always says, and you're 300.
3 of them.
Yeah, and you're trying to battle that down. You're kind of just battling these hormones that can go away quickly. So just, be mindful.
What if you're not on insulin?
If you're not on insulin, then, you might have to talk about other medications, but then always a walk or something, can help bring those down.
Yeah, and I'd say, the stress also affects your behavior. I mean, if you asked 100 people, when you get stressed, do you eat more food or do you take more of your diabetes medications? Yeah. It's probably the former. So pay attention to that as well.
Well, we're getting close to kind of wrapping up. I think we should talk about maybe some positives.
Yes.
How you think this might kind of pan out, where you see this going, anything you want to start to kind of lead people with.
Yeah, I'll start off a little bit. First of all, I do think it's going to go away like every other virus, like we're starting to see in other countries and other states even. I think the more vigilant we are now of staying at home for long-term gain. So I think one positive thing that's come out of this is the continuation of telehealth. Because if it's effective and you, the person with diabetes, likes it, it's so easy and convenient for you, we may continue this to the folks that want to continue doing it that way. And I think that's important. And if you could, as Jeremy said, be mindful of your exercise, your health, what you eat, you might continue on some of these good habits that go through. And what I'm trying to do is reach out to friends that I haven't spoken to in a long time. Every single day I'll think of the list, and I wrote a list of friends I haven't spoken to in a long time, medical school buddies, high school buddies, and I'm calling one every single day. And that's something that I want to continue when this whole thing passes, if I can. What
now I feel bad that Steve hasn't called me at all, so I guess I didn't answer this.
That's because I talk to you a lot.
Well, I would just say, let's be realistic, that this is affecting everybody in kind of every way. It affects, our social interactions, it affects us financially, makes us concerned about our health. Everything is changed, but I do agree with Steve that we're going to come out of this, hopefully sooner rather than later. And, we'll see on the other side of this what comes out of it. I have been doing more connections with friends and family. I think there's been a movement now to, like I said, for getting rid of co-pays and really kind of figuring out the price of insulin and these other things and video visits. So I think when we go through something unexpected like this, we really kind of have to stop and pause and kind of re-examine our whole system. And we'll see. I think we'll be dealing with this, in some way for a long time to come. But hopefully, looking back on this in a positive way and making sure this doesn't happen again, that we're more prepared also.
Yeah, I mean, this is not a joke, but I did hear that the number of divorce attorneys are way more active. So maybe staying at home makes you realize that there's something that you should have done ahead of time. I have no clue. Everyone's different. And I've gotten a lot of requests for Viagra. So there are some people that are really taking advantage of it in a good way. Others, are trying to figure out what they're going to do with their partner and others. And the best text I think I got or email from a patient was, it said, day 2 of homeschooling, trying to get the student transferred out. So I think you're all seeing the humor stuff on the internet, and I think humor's good. And I just want to say that we both realize that some people have a much harder time than others, and you should not feel self-conscious about that or feel bad about that. We all have different makeups up here.
Yeah. All right, maybe we'll do one last question, then we can kind of wrap it up.
And we can do this again if people like it and there's a request for it. So
yeah. So it says, as diabetics, are there any foods, meds that could strengthen our immune system, or just the same as others? Wash hands, don't touch your face, etc.
Well, I'll be honest, I'm not an expert in that area. We are going to do a video program with Jody Stanislaw. So she kind of is an expert in that area. What are some of the things we can do ourselves through the things you mentioned? I would say this, keeping your blood sugars under good control will help. And I'm a big believer in exercise can help strengthen your immune system. Don't ask me the mechanism. Jeremy has a minor degree in immunology, so I think you should be answering this question.
Well, I think it's the same stuff. Blood sugars for sure. Number 1, 2, and 3. Making sure you're eating well, sleeping, getting some sleep, your 8 hours is really important. But in terms of should I go out and buy supplements, the short answer is no. It's amazing when you go through your health store or whatever, everything that says like immune support on it and stuff like that. And my take on that is it probably won't hurt you, but there's no evidence that it will help. And these things can be kind of expensive, so to probably avoid that. I mean, trust me, if we knew that vitamin C helped, reduce COVID infection, everybody would know it, and people would be on this. So, unfortunately, there's no real thing to go out and take to make you feel better that you're boosting your immune system, other than the normal stuff that everybody should really kind of be focusing on right now.
Getting good sleep and trying to reduce your stress. Any way that works for you. Just be careful too. There's a lot of scams out there now, taking advantage of people's fear about the COVID virus. So be careful. And supplements, sometimes they're good, but they're unregulated. They can print anything on the label. So I agree with Jeremy. I wouldn't take them. And in addition, some of them can be harmful.
Yeah. So anything you want to say to wrap up?
You go first.
Well, I just think again that there's a lot of misinformation out there. There's a lot of fear. So kind of getting information from trusted sources. Take care of yourself and control your diabetes just like you normally would. And I think we'll all get through this.
Yeah, on our website, there's a section that says Living Library of Resources, Topics A to Z. We have a blog there on the right. And Lynn Scharf, who is our website person, at least when it comes to the blog, she looks at every single question and she sends them off to Jeremy or myself, and we answer them. So if you have any questions further, we'd be happy to take the time to do that. And in the meantime, sincerely take care of yourself. Try to make something positive about this. Hug your loved ones if they're at home. Call the other ones if they're not. And check out the rest of our videos on the series.
Yeah, I just got this bolded here, so I need to say this. But
okay.
It says we'll have weekly videos coming on this topic, so sign up for our newsletter on our website and stay tuned on our social media. So that's another silver lining of this. It gives Steve and I time to do stuff like this, videos, and hang out 6 feet apart. So there'll be lots more coming from TCOYD. So hope you enjoyed it. I guess that's it.
That's it. And yeah, we're going to do a lot more video education as well, not just particular to the coronavirus, but we're going to do almost every lecture we do at our major conferences, one at a time, try to get the right visual, and we're going to put it on our website. So thanks everyone for joining. I'm going to let Jeremy end the session.
I was going to sneeze, and that would not have been a good way to end it. But that's it. I have nothing else to say.
Okay, thanks everyone. Take care, and send us some good vibes on the blog.
All right. Bye-bye.
All right. Bye-bye.
I'll let you do it, Steve. I'll stay put.